I'm Ruth O'Regan. I'm a professor of medicine and division chief for hematology and medical oncology at the University of Wisconsin. So, determining menopausal status is actually pretty important for patients with estrogen receptor positive early stage breast cancer. And unfortunately, it's not as simple as you would think, actually. So, typically, what we will do is in a patient who's premenopausal, we'll typically put them on tamoxifen, unless they're very young, which I'll talk about in a second. And tamoxifen doesn't actually induce menopause, but it actually can cause irregular periods or even stop menses altogether. If that happens, what we would typically do then is start checking both estradiol levels as a measure of estrogen, but also FSH and LH because they go up as you become postmenopausal while estrogen levels go down. It's important to realize that this is not something that happens overnight. So usually I will start, once patients become amenorrheic, I'll start checking estradiol and FSH and LH probably every 6 months for at least 2 to 3 times to make absolutely certain that a patient is postmenopausal. Because the last thing you want to do is put a premenopausal patient on an aromatase inhibitor because that can, as I say, increase estrogen levels. So that's typically what we do. Now, there are some scenarios where it becomes a little bit more complicated. So if you have a patient you've given chemotherapy to, particularly somebody who's maybe in their late 40s, early 50s, it's not uncommon for the chemotherapy to induce amenorrhea. You have to be super careful though, because they may not actually be postmenopausal. So I'll usually start those patients on tamoxifen and then monitor their menopausal status with the estradiol, FSH, and LH. In younger women who particularly have higher risk cancers, based on the soft text trials, we typically will take a slightly more aggressive approach to their endocrine therapy by using ovarian suppression, usually with an LHRH agonist, along with generally an aromatase inhibitor, but there's also some data of doing that with tamoxifen. And in that instance, I do think it's important to measure their estradiol levels because even though these LHRH agonists are given every month or every 4 weeks rather, it's still, particularly in a younger woman, it can take quite a while to actually suppress their estrogen levels. And again, you don't want to start an aromatase inhibitor until you're sure that there's no ovarian function. So they would be the two main areas. It's somebody that's kind of perimenopausal, where you're trying to determine what their menopausal status is with the kind of thought about changing from tamoxifen to an aromatase inhibitor. And then these younger women where you want to make sure that they have ovarian suppression and want to put them on an aromatase inhibitor, checking estradiol levels in that instance also makes sense. Because we've all had patients that we were convinced they were postmenopausal. You give an aromatase inhibitor and then they start having periods, and we just don't want that to happen to patients.